Welcome everyone to the first of 6 of our Elevate Your Career Next Level virtual events. My name is Joshua Crew and I'm the Director of Alumni Engagement here for the UConn Foundation. I'm joined today by 2 of my colleagues, Elissa Kelly, Director of Alumni Relations for the College of Liberal Arts and Sciences, as well as Caitlin Kraus, Director of Alumni Relations for the School of Engineering. And we're going to be your point of contacts today should you need anything. And we're all on behalf of our career work group that here at the Alumni Relations Office, we welcome you to today's session on the healthcare industry. For those of you who have participated in the past with our Elevate monthly events, as you know, normally we would be visiting you in no less than 20 regional cities throughout the country this month. But alas, like many of you have had to pivot with other areas in your lives, we too have had to shift our efforts this year and bring what many of you have labeled one of our more valuable series into this virtual space. So while we wish we could be with you all today, sharing a drink, having conversations in person, talking about professional development, we only hope that by this time next year, we can return to some semblance of normalcy and bring this session back to all of your regional areas throughout the country. Well, despite the challenges of being virtual, though, we will be doing our best to provide you a great discussion today, worthy of your time, and in all seriousness, giving you one more Zoom meeting to attend. We realize that you probably are on these 6 to 8 times a day, so we appreciate you taking another hour to join us today. Today, before we begin our Elevate series, featuring some incredible Huskies at the forefront of healthcare. As you most likely gleaned from the title of today's event, the majority of these Huskies have not gone on to medical school and may not have had the most traditional path to what they do today. But our hope today is to provide you some insight into what fields are now becoming more prevalent within healthcare and how you can find them and where not so traditional tracks may be available to you within the healthcare industry. While COVID-19 surely has been at the forefront of all of our news feeds, these Huskies can talk to you about how this global pandemic has not only shifted their roles, maybe helped to elevate some of their fields, and perhaps even create a pathway or a new field as a result of the global health emergency. Now, before we get into everything here today, just a couple of quick housekeeping items. And as we usually do, first, the chat is open for you to engage and connect with your fellow Huskies. So whether you want to drop your LinkedIn profile in there, engage with each other, let us know where you're logging in from. We always want to kind of be able to chat with you all throughout the session, so feel free to jump in there now. And additionally, as we've learned from all of these sessions, there's always questions that pop up, and we definitely encourage you to feel free to jump in there. So feel free to use the Q&A specific function on your toolbar when you have questions. And as I mentioned, the chat tends to fill up. So if you can keep your Q&A streamlined to that section, Dr. Alerte will be monitoring that and be fielding those questions out to our panelists. So as we mentioned, drop into the chat. Let us know where you're logging in from. We'd love to hear from where all of our Huskies are dialing in from today. And last, I would definitely encourage you as you're beginning or looking into your career areas to connect with fellow Huskies, whether that's on LinkedIn or whether that's in your regional area. We have Facebook groups for almost all of our 27 regional groups across the country. So if you're living somewhere in the United States, there's a very good chance that we have a Facebook group that you can connect to. Now on to today's topic. To help us dig into this conversation, we have one of our own, Dr. Anton Alerte, full professor of pediatrics for the UConn School of Medicine, and one of our fantastic faculty members. He's a graduate of UConn School of Medicine himself and has received numerous awards and distinctions, including being named the Physician of the Year from the South Marshall House Clinic, various teacher awards from Kaiser Permanente, and numerous excellence awards from the American Academy of Pediatricians. He currently serves on, and there were so many boards, I had to narrow it down, Dr. Alerte, countless boards, including the Sports and Medicine Science Academy Industry Advisory Board, the Foundation for Children, the Council on Medical Education and Pediatrics, the Connecticut chapter of American Academy of Pediatrics, the American Association of Medical Colleges, and countless others. So we are thrilled to have such a panel of rock stars and you leading the way, and we're thrilled to have you joining us during what I can only imagine would be a normally busy day for you. So Dr. Alerte, thank you for joining us, and I'll turn this over to you.
Thank you very, very much for that very, very kind and like literally I'm blushing introduction. I am honored, I am tickled to be able to be the moderator and share the screen with today's panelists, all Huskies who've come to kind of share their path and their careers with you all. So thank you all for being here. So I'm going to go and just tell you who's on the screen. And then I'll let each individual panelist introduce themselves and give you the 60-second kind of descriptor of who they are, and then we'll start the conversation going. So we'll start with in alphabetical order. So Commander Allison Halpin is here. She is the Associate Director of the Office of Scientific Innovation and Integration at the Center for Disease Control and Prevention. We have Ellen Morello, PT-DPT, who's a Senior Clinical Program Manager at Physera. We have Theodore Ted Stack, the Senior Director of Portfolio Management and Global Product Development at Pfizer. And Heather Sun, Senior Director of Medical Information and Review and Medical Affairs at Allium Pharmaceuticals. So with that, I will open it up to our panelists, probably in the same order I introduced you in, to give you a bit deeper description of who they are.
Thank you so much, Dr. Alerte. Hello, everyone. I'm so pleased to be here. Thank you so much for the invitation. As Dr. Alerte mentioned, I'm Commander Allison Halpin. I'm a commander in the Uniformed Services, the United States Public Health Service. I graduated from CLAS at UConn in 2005, and I subsequently received my PhD from Yale University in epidemiology of microbial diseases. After that, I went down to CDC, where I've started my career there and in the public health service as an epidemic intelligence service officer, where I worked for 2 years in foodborne outbreak response and programmatic work. Subsequently, I joined the Division of Healthcare Quality Promotion, where we're responsible for basically anything and everything that happens in a healthcare setting. We try to keep patients and healthcare workers safe. And for the last 5 years, I've been the Associate Director for the Office of Scientific Innovation and Integration, which is basically responsible for leveraging innovative and novel technologies in the laboratory and in silico, sort of from a computer's perspective, to improve patient safety. And again, I'm so pleased to be here with this wonderful, amazing group.
Thank you, Commander. Who wants to go next?
I think I'll go next. I'm Ellen Morello. I am a Senior Clinical Program Manager at Physera. Physera is an app-based program that we deliver physical therapy virtually. So we've been working on a telemedicine platform for physical therapists. We have an animated exercise program. We do virtual visits. It's a nice program. And I've been doing that for about 3 years. So even before the pandemic, practicing exclusively telemedicine. I graduated from UConn in 2009 with my BS in physiology and neurobiology, and then went on to New York Medical College to get my doctorate in physical therapy, and worked clinically for a few years before working for an app-based startup like Physera.
Theodore, I think you're next. Oh, you might be muted.
Okay, that'll work.
Yep, there you are.
Sorry about that.
It was going to happen eventually. So
Yeah,
to one
I
of
might as well get it
thank
out of the way right up front, I guess. Yeah.
Yeah, exactly.
I'm Ted Stack. I actually graduated in the class of '81 from UConn. Went on to get master's degrees from RPI and also Brown University. I started my career at AT&T and worked there for several years before moving to Pfizer R&D in 1994. Went through various roles in finance and project management to my current role, which is primarily consists of about 50% operational and 50% financial management of the inflammation immunology portfolio. I have some responsibilities across other portfolios within Pfizer.
Thank you very much. And Ellen Soon.
Hi, everyone. I'm Heather Sun. I'm very pleased to be with you today. I am a graduate of UConn School of Pharmacy in the year 2003. And after pharmacy school, I did a postgraduate research fellowship in infectious disease pharmacotherapy at the Center for Anti-Infective Research and Development at Hartford Hospital. When I completed that, I joined the pharmaceutical industry. I started working at AstraZeneca back in 2005, and I've been in the biopharma space ever since. So my career has spanned past more than 15 years, primarily in the medical affairs arena, with half of my career in medical communications and the other half in medical information. So right now I'm at Alnylam Pharmaceuticals, which is a biopharma company in Kendall Square in Cambridge. I'm currently the Senior Director of Medical Information and Review. My team's function is primarily to be a resource for external healthcare professionals to answer questions about our products. And so that's me in a nutshell. I'm very pleased to be here, so thank you.
Thank you very much, Heather. Thank you very much to all of you. Okay, so just so you know, participants, the question line is officially open. So if something that you hear, if something kind of sparks your fancy, if something kind of draws a question from you, please feel free to put it in the chat, and we'll definitely try to get all of your questions answered in the time that we have today. But I'm going to take moderator's privilege and start with the first one alphabetically. Anthony Alerte gets me in front of many lines. So I'll take this privilege. And this is kind of an open question to everyone. Where you are now, is this where you expected to be when you started? And I'll just let you guys kind of just go with it.
Well, I can take that if you want, Dr. Alerte.
Sure, no problem. You can call me Anton now.
The direct answer to that for me is definitely no. I fundamentally believe that you have to take your opportunities when they come available. And so you can plan, but you have to adjust your plan based on opportunities. And Mike Rowe has a pretty good thing on TED Talk he's the guy that did Dirty Jobs, about opportunity versus calling. And I think, there are some people, probably yourself, who have a calling, right? You were called to medical school, you were called to be a physician. I didn't have a calling, but I needed to take advantage of any opportunities that I was presented with, and to the extent that I could make my own opportunities. And so I really believe that as you move through, you need to align your expectations with where you are and what you can do. You need to sometimes take jobs that maybe aren't glamorous, but provide a skill that you can learn, and then do a good job in the job that you are in, and then move to a job in an effort to move to a better job. So those are things that I feel pretty passionate about. You got to pay your dues, essentially apprenticeship. And then what that results in is you don't end up where it's not a straight line where you're going. It's a series of parallel moves and hopefully progression along the way.
Absolutely. I think it's not just what you know, it's how you apply it. And that's how you apply it, everything from actually applying the subject matter expertise to being a hard worker and someone who people want to work with. I actually find that that's been one of the biggest things for me, is people know that I'm good to work with. I try to be inclusive and collaborative and really care about people. And I think that reflects really well over time. And we do learn a lot of that during, our college years when we're first independent. And definitely, I had no idea what I wanted to do when I got to UConn. I knew biology seemed practical. My parents always said, do something you can get a job in. And so biology just seemed really practical. And then I took Tom Terry's microbiology class, and I thought, whoa, this is so cool. And Tom Terry, for those of you who don't know him, was this amazing teacher at UConn. He's fabulous. I just knew that, you just keep doing things that you like. And for me, it worked out really well. But again, not a straight path.
Yeah, I'll add on to what Ted was saying before about just following the opportunities that come, because, you know, I went to pharmacy school. I knew I wanted to be a pharmacist, but my track was to be, you know, a retail pharmacist and work in a CVS or a Walgreens. And that's what, up until April, before I graduated in May, that's what I was ready to do. And it wasn't until I happened to meet a program director at the lab that I ended up working at after pharmacy school that my whole course just changed, and I haven't looked back since. So it's really, you know, being in the right place at the right time sometimes, and just being fortunate to meet certain people along your path that will help you along.
I think I'll add too, you know, I didn't expect to be here for sure. I thought, you know, physical therapy is very hands-on as a profession. But I started to think, you know, not just about an opportunity for a job, but where is the profession heading? Where are the innovations in healthcare? And I wanted to be at the forefront of those innovations. So I took a chance and started with a very early stage startup and a few years back, and had no way of knowing that telemedicine would eventually be widely adopted amongst a physical hands-on profession like physical therapy. Could not have seen a pandemic coming. That sort of forced a lot of people to practice in this care delivery mode. But I did see that it was an innovation that would change the profession, and wanted to get in that field as soon as possible.
Great, thank you all. And I'm liking the energy from our audience today. I will say that, because Meg Malberg has our first question of the afternoon. And her question is this: thank you for taking time to present today. UConn has a large number of students who enter on a pre-med track. How can we encourage more students to consider a broader range of health major fields without discouraging them that they won't make it into medical school?
I think that's a great question. We may not be the best to answer this because we didn't go to medical school. Yours, Dr. Olerte, but I also know that
That's me.
I work with MDs who were English majors. You know, the smartest infectious disease doctors I know studied history. And so I think, you know, if you have a brain for medical school, you'll be able to, you know, recognize that there's certain things you have to do to take the MCATs, and there's certain things you have to do to develop your sort of self as a student. And, you know, that's what liberal arts does give you. And so I think it does seem like if you want to be a doctor, you've got to follow this straight and narrow path. And that's not to say that any of us couldn't have gone, you know, to medical school after our degrees. But I agree. I think it's scary to do something different. But, you know, sometimes being yourself can, I imagine, not being an admissions officer, but it might be more appealing too, to show that you have a broad range of interests and you're able to manage and multitask.
Okay. Thank you. We have another question from Karen Coombs, and she asks, what advice can you give a graduating student who is torn between two graduate programs, psychology and DPT, end goal working with children with autism and developmental delays? Okay, and Karen, DPT, if you can type in what that means, because I'm not even.
It's really a doctor of physical therapy, right, Ellen?
Well, thank you. And this is why we brought you all together. Fantastic Four. Thank you. Because I was going to have to Google that. All right. So she's torn, or she's asking for a friend, torn between two programs, psychology and DPT.
Okay, so it sounds like her end goal is working with children with autism and developmental delays. So this was actually an area I went into immediately after getting my DPT. I worked in a school-based pediatric setting for about 4 years with children with a number of disabilities, not just autism, but autism was the primary diagnosis in several of the schools that I worked in. So it is a rewarding field if you want to go into pediatric physical therapy. It is a collaborative field. You will be working alongside occupational therapists, speech therapists, special education teachers, school psychologists. I guess it's the question you're asking, it sounds like a difference between you're interested either in helping psychological development or physical development. So I guess it would have to come down to you and your preferences. Physical therapy in that setting can be physically demanding. You are often working with children with pretty severe physical limitations. So it's often assisting children who may be in wheelchairs. So for me, that was like just one off the top of my head key difference I can think of between the two. But if you are in either of these professions, you could consider ways to incorporate, physical development or psychological development. And I think anyone working with children has to take a sort of holistic approach to child development, and you're not just treating a child's physical impairments as their physical therapist. So just from my experience, you can find ways to incorporate psychology. You will definitely find ways to incorporate behavior therapy into every physical therapy treatment you do as a pediatric physical therapist. But I guess it depends on your real interests.
And if I may, thank you very much. And if I may interject, as a pediatrician who does a lot of developmental assessments, I think it is a multidisciplinary, very collaborative approach to helping these children. And my advice, even though I'm not on the panel, would be start talking to people in those fields. Start interacting and engaging with those people to say, okay, so what's a day in the life? We're trying to do that here with our panelists today. And we have the skill set, but start talking to the folks who maybe work at Birth to Tree, or work with children, or work at school and provide special education services to kind of get an idea. So what's your day-to-day, and how does that look like, and what does your role in this world really look like when you're actually in the field? And that might be my advice. Just throw it in. All right. Okay. We have another question from anonymous attendee. Mysterious. An anonymous attendee wants thoughts on a BS MD programs versus MD or DO programs. Thoughts what to look for in college if wanting to go on to med school. Does that sound like a me-shaped problem?
Yeah, I'm not sure if we can answer that.
Yeah,
exactly. We didn't go to med school. Sorry.
Yeah.
Maybe Josh will have to organize a med school one day.
Yeah. Well, yeah. So I think I will try to do something. Look at what you want to do. The school is a pathway to a career, right? And our panelists will talk to you how what they learned in school was a pathway to a multitude of careers beyond the Bio 101, organic chemistry, first semester, kind of thing. So really start looking at what you want to do after med school. If you want to be a physician, okay. If you want to be a nurse practitioner or an advanced practice, nurse, okay. If you want to be a paramedic, okay. But look at what the end goal is going to be, and that will probably help with the pathway. Right? Sharon asks, given the C19 death and post-disease losses, which will be calculated over the next decade, where is their spacing? Oh, and I do apologize, Sharon. The scrolling is automatic. So I will ask your question again. Given the C19 death and post-disease losses, which will be calculated over the next decade, where is their spacing / training / focus? The medical community for bereavement and soft skills for UConn BA English Lit majors, second career after recent retirement. Okay. So Sharon, you can correct me, and you can, if I kind of interpret your question incorrectly, so please feel free to lay the smackdown of clarity to me. But I think it's, where is the role for the thinkers, like the literary thinkers, the historians, the communicators, in a world where we are going to be seeing not just the medical consequences, but the emotional consequences of everything that's gone down and is still going down due to this pandemic.
I mean, I think in general, the healthcare field really is starting to focus not just on making sure you know all your hard science skills, but the soft skills. It's becoming really patient-centered care. And, you know, we don't know what the post-COVID-19 pandemic is going to look like. And I think, you know, the house is on fire and we need to put the fire out of the pandemic required a lot of science and infectious disease and healthcare delivery issues. But you know, the longer we're at this, the more we're starting to see efforts on focusing toward the other sort of unintended or sort of not well illuminated consequences. I think there was a CDC put out an MMWR maybe a week or two ago talking about, you know, school reopening and how it's important for kids. And that, you know, we're starting to have data now to show how do we do this really safely.
There's a lot of interesting literature too about the effectiveness of physician empathy in treating a number of conditions, even, you know, just so I think as you're asking sort of about training programs that you could apply for bereavement, and you know, there's support groups that need to exist for all the people losing loved ones due to COVID-19, but also training for physicians who may not necessarily have, you know, the best like bedside webside manners for empathetically working with this population. So if you have experience working with that might be you could create some trainings or assist the medical community in that way. I think that was what I was getting out of your question.
Yeah, I was just going to add that, you know, we have healthcare providers that are going through a lot of the bereavement now, right? They've been at the front line, they're tired, and you're not going to get a more empathetic group than them. So I think if you're able to engage some people maybe that have worked and on the front line and have seen what they have to deal with, and then ask them, you know, engage them with what they think is needed, I think you'll get really good answers.
Thank you. Thank you. We have more questions coming in, and I think this one is actually directed to Heather. This question comes in, and it is actually like playing off of the networking discussion that we had, you know, find out about people who are working in the field. And this question is, being in Boston, how has networking helped you in your career at this point and what you're doing now?
Yeah, great question. It's helped tremendously. Boston, Cambridge, fortunately, is a mecca of sorts of biotechnology and pharmaceutical companies. And so there are a lot of companies in the area. And then when you've worked in the field as long as I have, you know, the people that you worked with over time end up at different companies, and the network is very small. And even just walking around Kendall Square, you'll see somebody that you've worked with in the past and you'll stop and say hello. So there's that piece is always an open line of communication. And so just being in this network is very valuable, because not only do you have people to contact if you're looking for people to join your team, but you can also reach out to other folks to say, hey, look, I might be interested in this role at this company. I know you work there. Can you tell me about it? You know, who's the hiring manager? So there's a lot of open dialogue that can happen where the companies are sort of all in a similar area. And then, you know, as a pharmacist, that network is even smaller. The pharmacy network within pharma is even smaller. We all know each other. And so we talk to each other all the time. And so definitely, I think it's really valuable. And it's another avenue to talk to different people who might be working in different areas that you might not know a lot about. And then you can learn and say, you know what, that might be something that I'm interested to pursue myself. And so there's a lot of opportunity there.
Oh, another question as we flip by, and this one is from Lisa Famularo. All of you mentioned that you didn't necessarily know what you wanted to do career-wise when entering college. What were the resources, people, or things you used throughout college to help you explore career options and make a decision about what to do, at least for your first job or first graduate degree after college?
I can start. So I was a first gen college student. So I didn't really have a good idea even in college what I was going to do. I think UConn primarily taught me how to study, and I think that's a key skill. And it also taught me things that I never knew. For one thing, actuarial science. I'll take that as a major. I had no idea what that was. Like, I went to UConn. They have a big actuarial science program, and I knew, oh, those are the people who figure the odds for the insurance companies. But it's that type of exposure that I had it was a whole new world to me. So to answer the question, I don't think I explored things until I got out of college, where the first job I took was actually, it was in collections, which is not the kind of job that anybody would gravitate toward. But you meet with a lot of different people, you learn how to talk with a lot of different people, and you learn how they face a lot of the different challenges in life, and you start to relate to people that way. And I think you can parlay those skills into other jobs, which, I was fortunate and in many cases lucky to do that. But I don't think you should limit yourself to thinking. It's easy to say this when you're out of college, but I remember when I was in college worrying about what I was going to do when I got out. I think the important thing is to work, to get a job. It might not be the job of your dreams, but get a job, get some experience, develop your skills, and then in that way you can kind of, as you're exposed to different things, figure out where you want to go.
There may also be opportunities to shadow. If you are interested in a certain field, there may be an opportunity to shadow someone working in that profession, or kind of be a fly on the wall for a day, just kind of see and get some exposure to what they're doing. I did that. I wanted to go into some medical profession. I wasn't sure exactly which one. I shadowed some different medical professions and asked them a lot of questions about what their lifestyle was like. That was something that was important to me, was having a good work-life balance. Just thinking of what's a priority to you in your career long-term, and asking those questions in the shadowing experience was really important for me to do that as well.
Oh, and we have another question, Ellen. Yeah, you may have remuted a little prematurely. You have another question, which really speaks to your doctorate in physical therapy and COVID. And this question asks, again from an anonymous participant, how did you do it? I am kind of summarizing the question, but how did you take something that's physical therapy and based upon contact, in close, intimate contact, and continue to do it and be successful in a COVID environment where we were all kind of distanced?
Sure. I will try to answer that succinctly so that I'm not taking too much time away, because this is my passion. This is my thing that I love to talk the most about. So physical therapy school, there is a component of learning hands-on palpation skills. There is a component of learning a lot of hands-on interventions. I would say the majority of the curriculum is sort of diagnostic, understanding movement patterns, understanding symptom clusters that as they relate to movement patterns, with a certain level of clinical experience. And after sort of watching enough people move, I think you can, and asking a lot of the right questions, you can do some of the diagnostic skills that we learn very well through, just a visual with a movement screens, with some modifications to some of the testing and screening skills that we learn in physical therapy school. and with asking like really good questions. For example, I want to know everything about their mechanism of injury. I want to know when it happens, how the different types of injuries. So asking a lot of questions and taking a lot of information that way. And then the other part of it is treatment. So there's two parts of physical therapy that is done remotely. There's diagnosis and then there's treatment. So for treatment, if you look at the literature, and this is where I always go when I inform any of my treatment approaches to practice evidence-based medicine and deliver the best care possible, the three most effective treatments that can be done for any musculoskeletal condition are therapeutic exercise, so moving your body more, getting some targeted exercise, teaching the patient self-management skills. So if they have an injury, you're coaching them how to manage their pain, how to manage their symptoms at home. Is therapeutic exercise, patient self-management, and like patient education are some of the most effective treatments. So educating the patient not only on their condition, but educating them on how they can make it better. So those are three treatments that we do that are the bread and butter of telehealth physical therapy care delivery. So it actually is quite effective. So we have been looking very thoroughly at the outcomes and at the literature of how effective physical therapy can be delivered remotely, and it's actually quite effective. So
thank you. Wendy Bowden comes in with a question. Thank you. And her question is, thank you so much for taking the time to talk to us today. My question is, what did you do in your undergraduate years to keep you motivated to get to where you are today? And I'm actually going to hijack Wendy's question and add a little bit of my own. What skills are you still using today that you picked up in college? So we'll let Wendy's question goes first, be fair, all right? So what kept you motivated to get you to where you are today? And then what skills are you still using to this very day?
Well, I was actually really fortunate to have surrounded myself with friends and roommates who were also really driven. And I think there's actually sort of safety in numbers there, that if everybody's studying together Saturday mornings, we're all studying together Saturday mornings. So for me, that was really important. And I think, I kept taking classes that I thought were interesting. And then your question, Dr. Lerte, could you repeat it one more time? I'm sorry. You're on mute.
It was going to happen to me as well. So thank you. So my question was, what skills are you still using to this day? What skills that you learned? I know Ted talked about just learning how to study, learning how to kind of get the information in, but what other skills are you using today that you kind of picked up at UConn?
So for me, I think there are probably three: writing, like really good writing, biostatistics, and problem solving. It's the first time you're out on your own for a lot of people, and things go haywire very quickly. And if you're willing to just attack the problem and fix the problem, that's really what most people care about.
I'd say for me, it's more of a soft skill, similar to what Ted said for, learning how to study, but I learned how to take notes effectively in school, and I still do that today, sitting in on meetings, and it's just important to know what to jot down and what to retain and remember. So
for me, I would say project management and some of the finance skills are the hard skills that I use on a daily basis, and they were pretty much brought to the surface at UConn and then refined later on. But the project management skills are nothing more than you've got something to do, and you got to back up and decide what you got to get done to meet that due date. And I mean, that happens in every business.
Cool. Thank
For
you.
me, I think it's the knowledge. I'm still a practicing clinician, so still using all of the physiology. It really has informed my clinical clinical decision-making and clinical skills. So a little different than the other.
Thank you very much. Emmy LePage. Hi all, thank you for taking this time to present. I am currently a senior communication major at UConn, and the healthcare field seems super interesting to me. Although I am not a health-related major, do you believe that there might be other opportunities available that are related to the sales marketing field at your companies? Oh. That was a rather, it got really specific at the end.
Yeah, I guess at Pfizer, for sure, there's a whole communication department that, you know, we have to communicate the results of top-line medical reports, and you do need, you know, some medical background to be able to do that effectively. But there's a whole, on the marketing side as well, you know, there's plenty of opportunities for that. You know, you're probably not going to come in as the president of the department, but, you know, you have to be willing to come in and do your time. But I think in most cases, those opportunities are there.
I mean, health communications is huge at CDC. I think people often don't think about this, but policy, communications, lawyers, you know, we need all these things at every company. And so I actually have found through my work that actually I really like health communications. I think it's super important because we can do a really complicated work. And if you can't explain it to someone, they're never going to follow what you think is a safe practice. They won't understand what you've done. And, you know, some of the best work that I've been involved in has been related to health communications work. And we really need people who understand what plain language means and how to get people's attention in a creative way. I think I just heard this morning there's going to be some Super Bowl ads related from CDC sort of partners. So it'll be really exciting to see these health messages coming out. And, you know, science is driving it, but someone has to put a nice sort of finish on it.
Thank you. Ray Peravi, and I hope I said that correctly. Thank you for taking the time to present today. From developmental products like Neuralink and to the modern Apple Watch's health and fitness features, we are seeing an increasing role in technology focused around healthcare. Do you see any growing careers in this space, and are there any steps you would take for someone interested in pursuing this kind of career? And may I add parenthetically, as the moderator, it's not just technology, which has always been a part of the science and medicine field, like something new, but it's really technology in the hands of everyone, not just a cath lab, not just the ICU, but like everyone's wrist now has access to medical technology. So back to Ray's question, do you see this growing and continuing? Or what steps you would take to kind of start kind of putting your interest into that field as a future career?
I know, I think I can help here. We've seen at Pfizer growing remote monitoring in our clinical trials. We have a joint program with Verily, which is a Google subsidiary right now, to do a sightless clinical trial, which is in dermatology, where you can take photos of the skin lesion, upload the photo, and have it read centrally. All of these things are in their nascent stages, and so they're all expanding. And I think, you know, to answer the question, it's definitely going to be a growing area. That's for sure. In terms of the background that you need for that, I think that's tough to predict. It's obviously you need a technology background, but you probably need some other things too to be able to figure out where things are going to be headed. But I think, you know, medical and technology, in terms of those two things to do that specific work, are probably the best bet.
Thank you. Oh, and now for a subtle change of pace. We are getting questions about the day-to-day. Commander Halpin. An anonymous attendee wants to know how do you get to be a commander in a civilian CDC, and what's that all about? I paraphrased this question.
That's a great question.
It was a very long question. It was a good question. It was a long question, so I paraphrased it a little bit.
Thank you for distilling.
Yeah, no problem.
Right. So yes, there are, if you go on the United States Public Health Service website, there's tons of resources that talk about, are you ready for a career in the public health service? And there are public health service officers in uniform like me at CDC. They're at the National Institutes of Health. They're at, working with the tribal nations and Indian Health Services. So we do work across federal agencies, and we're at CDC in the minority. Most people are civilians, so most people are not uniformed at CDC. I actually entered at the same time I commissioned at the same time I entered CDC's, it's a postdoctoral fellowship. It's an applied fellowship called the Epidemic Intelligence Service. And that's an option when you join. You can just straight commission if you have the right qualifying degree. I'm in the scientist categories because my qualifying degree is a doctorate, a PhD, but there are pharmacists, nurses, physical therapists, physicians, environmental health officers, and people with master's degrees. Some go into environmental health, some go into health scientists. And then a lot of hard work. You go from lieutenant to lieutenant commander to commander and sort of keep going up the ranks.
Thank you. Thank you. Another question as I'm kind of like looking from screen to screen as I'm getting different questions from different people. This question is to everyone, again, from Anonymous. Biggest change due to COVID beyond us being on Zoom in terms of the career? I mean, the biggest change or the biggest pivot that you've had to do because of the pandemic?
Well, I can start. My job has completely changed. I haven't done my job in a year.
Okay.
Most of last year, I was responsible for, I started off the year, I was deployed. I was on the team responsible for helping receive the first planes returning from UConn as part of repatriation efforts. So I did a couple of those. And then when I came back to CDC, I was deployed to run a diagnostic testing laboratory. I'm a microbiologist, but I really love bacteria, viruses. I'm not a specialist, but I have become much more educated in that area. What I was really good at, or what I am really good at that they know, is that I know how to run a diagnostic laboratory that falls within CLIA. So the clinical laboratory improvements and amendments. So that basically meaning we can report things back that go into helping to care for patients. So I did that pretty much all last year. And then about a week ago, I was, I'm still deployed, but they switched me and now I'm working on emerging variants. So I really haven't thought about our typical healthcare associated infections in about a year. But that's been a very big change.
I can give the opposite perspective because my job has not changed really much at all. I've been working from home for 3 years. The only thing that's changed is I don't really travel anymore to either our headquarters or to our customers. And the only other change is that telemedicine's become a bigger thing. So I now manage more people. We got to hire a lot more people to serve a population that was more and more interested in telemedicine. So, but otherwise day to day, it's pretty much the same, exactly the same.
I can go next, I guess. Beginning in March, we had to reprioritize a whole bunch of clinical trials in terms of the investments. I don't know how many people know, but Pfizer was able to benefit from Operation Warp Speed in terms of the regulatory environment. But we didn't actually take development money from the government for that. And so we had to quickly pivot reprioritize our internal investments in order to be able to solve the problems that money could solve, which is really one of the primary reasons that the vaccine was delivered on time. Usually those investments are very much staged because of the riskiness involved. We didn't do that. We put money behind the manufacturing scale up and all of that. And in order to get that money, it's a zero-sum game. It had to come from somewhere within Pfizer. So really, that was what I spent the majority of my summer doing, along with evaluating. We had call out to a lot of biotechs to, we would try to help them progress their programs if they would work in COVID-19. So we evaluated a bunch of those external opportunities as well. So mine got really busy I would say from March until maybe October. And then it kind of sort of, once we delivered the vaccine, the beating stopped, I guess is the way to put it, but things calmed down a little bit.
Yes, I'll close the question out. My experience is similar to Ellen in that my day-to-day job really hasn't changed. It's just how I'm working has changed. So since March of last year, I've been working from home. So how I communicate with my colleagues is a lot different. I don't see them in the office anymore. You don't have the face-to-face interactions anymore. I'm not traveling to conferences, and learning is a different way as well, because I used to go to scientific conferences a lot, and not being able to do that anymore. You have to find new ways to communicate with your customers and your colleagues. So the way to work has changed quite a bit.
That I am muted. So, Shivani Paddy, hi everyone. Thank you for the session today. You're welcome, sir. I was wondering what your thoughts on the Fauci effect are. Due to the pandemic, there's been a greater interest in medicine and healthcare, and I was wondering, how will this affect the opportunities for people interested in medicine? So, Fauci effect.
Oh no, I guess it could become more competitive if we're suddenly seeing more interest in people following the healthcare pathway. I'll say, there are lots of opportunities, though, as you can see from this panel.
I guess I would add to that, one thing we see is the Fauci effect is the value of communication. Right. So the person that asked the communication question earlier on, I mean, that's a perfect example, right? The way you engender trust is you communicate effectively to people, and to be able to get the vaccine out effectively, you need trust. People need to trust you. And so, I think that all kind of goes hand in hand.
Thank you. Oh, and speaking of now, a more specific question, Monojit Paul, I have just begun an MS program in business analytics and a project management at UConn. I feel there is a huge scope of data analytics in the healthcare sector. Have the panelists come across people with analytic skills working in the healthcare sector? So.
Absolutely.
Yeah, definitely. In the biotech pharma world, we have data, it's a huge component of what we do, and all sorts of different data, from market research to biostatistics to everything. So definitely it depends on your interests and what sort of analytics you want to do, but there's definitely a huge opportunity in biopharma for that.
And technology and in general medical practice too, even just like taking data sets of clinical outcomes and analyzing them, or informing products. The applications are wide and varied, and I work very closely with our data science team too, to help inform our product. And determine what's effective in healthcare, and that's critical. That we're always looking at effective care delivery, and we need the data to inform that.
Okay. All right. Anonymous attendee has another question. As you've been mentioning, there are a lot of changes to how things work in the healthcare industry due to COVID. Any ideas of upcoming trends we'll see in the next few years? Oh, so a bit of prognostication from our friend Anonymous. Okay, so what do we think? Look at the tea leaves. What do you think is going to happen?
Ellen's going to be really busy.
Yes, telemedicine is trending. And I think now that people have tried it, they believe in it a little bit more and accept it and understand. So I think it's only going to continue to grow. I think perhaps there was some skepticism initially. It's how do you deliver effective care in a virtual environment? Now that people have had a chance to try it, and it's a preference, it will certainly continue to grow.
Commander Halpern will be starring in a feature-length movie probably, and how the surveillance takes place. And yeah, I don't know what else to prognosticate here, but I think those two things are probably pretty safe bets.
I picture jumping out of a helicopter, but that's just me. I've watched way
You
too
guys
many
are
adventure
nuts.
films. Okay, I'm just scanning the questions. Anonymous again. I'll be graduating this year, but feel as though it's hard to find a job as a biology major. What are some career pathways for a biology major? Oh, I'll start off and say lots of stuff. It's a nice thing, lots of stuff. But folks, what do you guys think?
Yeah, tons. I mean, I mentioned it in the chat, but I'll just reiterate. There's CDC has tons of fellowships, and we have lots of laboratories, just like I'm sure Pfizer does too. And we have fellowships set up to improve training and education. And I think some of it is deciding, was that enough for you, or do you want something a little bit more advanced and specialized? Do you want a master's in public health? Do you want to really understand how to do research with a PhD? Do you want to go to pharmacy school or a PT? So I think, yeah, some of it is just asking and Googling.
Yeah, I'll add to that, I guess, I ended up doing finance and project management, but one of my master's degrees is in biology. And yeah, the easy part is the finance and the project management. That's what I always say. The hard part is understanding the business, especially biopharma. And so, biology allows you to do that. And I think if you just look across any biopharma company, there's going to be opportunities that way.
Oh, we have my goodness, we have a combo question. All right, and I'm actually going to piggyback and piggyback this question. Balancing, and this question I hear a lot. And one of anonymous again, busy bee, that person is, asking about balancing life and career, which is like everything. This is the big question that spans the gamut, balancing life and career. And of course, I'm going to jump in on this and add, I hear there's a go bag somewhere in your house, Commander Halpin. So speaking about balancing life and career, guys care to speak about right choice? Is it the right choice for me? Is it the right choice for us? Where should we go? Can you wait while I try to figure this out? How does that actually work when all of this parts are moving simultaneously? Again, I summarized this question.
Well, I heard a go bag mentioned, so I guess I'll start. I mean, I think a lot of this is like spinning plates, right? Like, how many plates can you keep up in the air at the same time? I'm really fortunate. My partner is just super supportive. He moved with me to Atlanta when we came, and I am on what's called in the public health service a tier 2 team, which means every 5 months I'm deployable within 48 hours for 2 weeks usually. And so, yes, I have a go bag packed with all my essentials like uniforms and laundry detergent. But, one thing we've learned is a lot about resiliency. And I think the Commission Corps Public Health Service has really focused on resiliency for a long time. So, my go bag always has extra headphones because I love to listen to music, and it always has chocolate in it because I know that like that's what I'm going to need late nights or, but yeah, I think for me, I think the only way to survive this past year and life in general is to make sure the balance works for you. Some people are most happy working all the time, and that's perfectly fine. And some people, to get their fulfillment, they need to spend time alone or with their family. And I think the one thing I've learned is no matter how wonderful the people you work with are, you have to take care of yourself. You have to be the one to stand up and say, I need this right now. I think this is how I can get it. And most of the time I found my coworkers and my supervisors have been incredibly supportive of that.
I guess I would just add that balance over time is not the same as balance at any one time. And so you're going to get peak workloads and you're going to have to work. It's just, if that's what you want, that's what you're going to have to do. But over time, that shouldn't be a constant. I mean, there should be times where you can, work a normal amount of time and interact with people in a normal sort of way.
I think it's sometimes you have to set boundaries too, right? As we're all potentially working from home, all I need is my laptop to work. So feasibly, I could work anytime at all times and there's always work to be done. So for me, sometimes I just have to set those boundaries of, okay, I know there's more to be done, but it doesn't need to be done right now and I can do it tomorrow, and trying to put my computer away for the evening. So trying to set boundaries if you're in a high demand field.
Yeah, I agree with what everybody has said. With the pandemic, it's obviously difficult, but Commander Halpin is right. You have to figure out what for yourself, you have to take care of yourself first, because you can't do a good job unless you are healthy and well yourself. I mean, my company has been fortunate that over the pandemic, they've given us a few surveys just to do a pulse check, like how are you guys doing? And what programs can we implement to make your life a little bit better in terms of wellness, childcare, things like that. And I've definitely appreciated those things that they've offered. And it's been great. But definitely resilience is really important in this environment.
Put your mask on before helping others, right?
Exactly.
Mm-hmm. I think this next question is really going to Dr. Morello. It's a paragraph, so I'm going to take. So you guys really do learn how to write really well at UConn. I will give you that. You all weren't kidding. But this question really speaks to telehealth and how you were able to create something that really hadn't been created before to the extent that it is created now, or make it so that so many people were able to do it. So I think it's about kind of creating it with like a blank book and saying, okay, it's a thing now. It's a big thing. It's the only thing. Go. I took a lot of artistic license with that, but I hope the question answer doesn't get mad at me. But
sure.
that was the gist of it.
Yeah, so I came into the startup seed stage. At this point, not a lot of people had either tried telehealth physical therapy or were practicing telehealth physical therapy. I believed in it as a treatment method. So I think my conviction really helped me, just kind of convince people that this could work. And working in an early stage startup does take a lot of willingness to do anything and put on a lot of different hats. And I feel like I kind of thrive in an environment that is one problem after the other, which, maybe is not for everyone, but I love solving problems. So if we have a new business problem, then it's kind of fun being a problem solver. So I think that approach has really helped me too. And I think that is required in any sort of startup environment or new technology. Is there's going to be problems, there's going to be implementation problems, there's going to be adoption problems, there's going to be business problems, there's going to be, who knows, technical problems. There's so many things, and each day you just got to roll up your sleeves and be like, okay, what are the solutions and how do we proceed? So taking that and knowing too, in a startup environment, no job is too small. Everyone is doing all different types of work. So there is no task that is too small or too big. No problem too big to be unsolvable. So taking that approach has helped. I don't know if that was quite the answer, but okay.
And a question to everyone. Lisa Famularo comes in with the meta question of the afternoon. So pretty much, expanding from, work-life balance and general stuff outside of the business card. But Lisa asks, have you had a mentor at any point in your career? If so, how did you begin that mentoring relationship? And what were some of the most helpful pieces of advice your mentor gave you?
I imagine everyone on the panel is going to say, yes, we've had a mentor. I think that is key to career success. Scientists in the public health service are required to have a mentor, more or less. And some of my mentorships have come from a very formal ask. I need help in this area. I see you're succeeding in this area. Would you have time for me? And I think others evolve more, for lack of a better word, organically. It's someone you've worked with, who you really click with, who, and it's a two-way street. I think I see that I gain a lot out of being a mentor. Hopefully the mentee gains a lot, but I do think that the mentor has the time and be willing and able. And there's so many people who are willing to be mentors. So I think, I think it's really just a matter of reaching out, and there are certain people you'll click with and others you won't. And I think actually a lot of the best advice I've gotten from them is just what worked for them. The tricks, the little things that nobody's going to tell you in the instruction manual that they figured out yourself. And so you get to stand on their shoulders a bit, and hopefully they sort of pay it forward to someone that they mentor in the future.
I guess I would agree. I don't think I've had a formal mentoring relationship, although they do have a formal matching thing at Pfizer where they can match you with a mentor. But mine has always been informal. It's always been several people that I could ask their opinion and bounce ideas off of and say, how would you approach this, et cetera. And, I would go all the way back to as you're growing up, a lot of it is, you get mentors and teachers and coaches and things like that. Parents. My dad was a big influence on me. So.
Yeah, I think one of the best characteristics a good mentor can have is just to be very honest and frank with you. I think the best ones have given me, you know, constructive criticism that I needed to hear, and it was, you know, you learn a lot about yourself, and you can take that forward in your job, and how you also, you know, I like to see myself as a mentor as well, and so. Like somebody said, you know, you can pay it forward and kind of apply those same things that you really liked about your mentor and pass that along to the next generation.
Thank you, guys. Wow. Well, oh, I believe the next question is for Ted Stack, and it's kind of short and sweet, which is refreshing. Thank you, guys. Thank you for questionnaires. You mentioned lateral moves. How did you decide when to make a lateral move or when to wait for a higher move? And like, how did you figure that out?
Yeah, it's not a science. I tried to look at it in the long term, like if I could get this next job and it might be more incrementally higher, but this other job will provide me with some experience that I don't have that could lead to better opportunities down the line. And I think the more options you can create for yourself in terms of what you're able to do. I think when I was talking to Josh, one of the reasons that I think aside from luck, that I've survived multiple downturns and resizing, or whatever euphemisms you want to call it, for corporate restructuring, is I have a lot of different skills and I can apply them in a lot of different ways, and that's as a result of lateral movement. And so, you know, I don't know if it worked because it's not a controlled experiment. You know, I could have been CEO, maybe, who knows, but I wasn't, so it did what it did.
Thank you. Thank you. Looking at the time, I think I'm going to take control back from the question list. And ask our panelists to, you know, say, is there any other little tidbits? Speaking of mentoring and giving those little tidbits, so to allow others to stand upon our shoulders, any little tips, tricks, things that aren't on the aforementioned manual that you'd like to impart to our audience today?
I guess I'd just say the more ways that you can connect with people, hobbies, you know, you get talking to people, you realize they have the same interests as you. That leads to other things. It makes it easier to communicate, and I think that at least has helped me along the way.
I would say stay nimble and be open-minded, because you never know what kind of opportunities may open up that you may not have expected, and it may turn into a career that you end up really loving and you just didn't expect it at all. So, you know, yeah, that would be my pearl, just to stay open-minded.
I think I'd add to that to be okay with going out of your comfort zone a little bit, because you might find something you really love. I grew up very strong introvert. I didn't like speaking in public. And when in some of my jobs at CDC, I've been really given amazing opportunities to learn how to do it, to practice it. And actually really, as I mentioned earlier, I love health communications now. I think it's so important, and I jump at any chance now to participate in it. And so you never know what you're actually going to like. Sometimes we just sort of get stuck in our mindset of, this is my job, this is what I do, but diversifying, and then it's a new skill too. I mean, you can't go wrong there.
I think my tidbit would just be, don't be afraid to put yourself out there. And if you are interested in something, to ask if someone can give you some more information about it, or if there are opportunities available. It doesn't hurt to ask.
Thank you, everyone. Thank you. All right. Okay, I'm scanning the rest of the question chat to see if there's anything. You guys were busy in chat. My goodness. Yeah, I think we've actually asked everything. Oh, Monoji Paul. My goodness, it just snuck in here. Is there a way in which we could reach out to the panelists, including Dr. Alerte? Ah, shucks, Monoji. Thanks. So I'm pretty sure Josh would probably be able to help with the communication.
I'll jump back in here. What we'll do is we'll ensure that all of our panelists are comfortable with that, and then make those introductions. If you want to send an email to me directly, all of you should have my email when you registered for this event. And then from there, with their permission, we can facilitate a introduction.
Okay, great. Thank you. Thank you. All right. All right. This is a last bell. Other questions from the audience? You guys have been incredibly communicative.
Well, I think given time, I'd like to just extend some thanks to all of our panelists and to Dr. Alerte for driving our discussion today. I think that anytime we get an opportunity to interact with folks of your stature and what you're able to do within your companies and how you've represented the university, we're just grateful for the opportunity, for the time. And obviously with the Q&A type of section that we did have today, you answered a lot of specific questions to folks who are looking for some key advice and acted as if you were the mentors right then and there for these folks. And I think that that's appreciated beyond words. And we thank you all for your time with your busy schedules, with everything that all of you are doing. So thank you again so much there. Before we wrap up today, I just want to make sure everybody is aware, as I mentioned, there are a number of programs that are tied to our Elevate Career Series ongoing. So the first obviously was today. We do have our next one coming up is Elevate Paradigm for Parity, and it's L spelled E-L-L-E for those of you familiar with the French language for her or she. So it is tied into our Women in Philanthropy program, our Women in Leadership. Paradigm for Parity will be happening on Tuesday, February 9th. On Wednesday, February 10th, we have our Beacons of Hope Social Change Careers, talking to folks who are working in various industry in the nonprofit sectors. Pivot and Adapt Sports and Recreation Careers during COVID-19. We have folks who are all the way from CEO of TaylorMade Golf to Senior Vice President of Vail Resorts, talking about how the pandemic has shifted their industries as well as where opportunities may lie. We have Putting It Together Career, that was on February 17th, before I forget that. Putting It Together, Careers at the Intersection of Technology, Business, and Law, talking about automated technologies and smart cities and smart technology that we're all starting to be accustomed to, whether that's Alexa or asking Google to turn on the lights, those type of things, and where those are heading, and the careers coming with those. That will be on Thursday, February 25th. And to wrap us up on Tuesday, March 2nd, we have a resume tune-up. We have the Center for Career Development from the University of Connecticut partnering with the career and management consulting firm that UConn Foundation has been working with for a number of years, partnering together to talk about anything from entry-level resume tune-ups to you've been in the field for 25 to 30 years and you're figuring out how to pivot in your career, maybe into another field right now. We have the people that will be able to help answer those questions for you. So if you enjoyed today or you're looking for additional information, feel free to jump on those and join us. Those will be recorded as well. And this will be posted up on our youtube.com/UConn alumni page within the rest of before the end of the week. So we'll get that out there. And if you are interested in signing up for any of those Elevate events, you can do that by going to foundation.uconn.edu and right to our events tab, and you'll be able to find that information. Did I miss anything from our panelists? Anything that we thought we might cover that we didn't get to? They're all scratching their brain going, I'm so hungry, I need to go find lunch now. That being said, again, another huge thanks on behalf of the UConn Foundation, the Alumni Relations team here at UConn, to all of our panelists and to all of you for joining us today. We hope that everybody stays healthy and well, and we look forward to seeing everybody next time. So thank you all for joining us. Take care, everyone.
Thank you.